Which of the following structure is part of the right ventricle? The options are papillary muscles, mitral wall, left atrium, or aortic wall. The correct answer is A, that is papillary muscles. Papillary muscles in the right ventricle help to control the tricuspid wall, ensuring proper blood flow direction during heartbeats. Question number 2. The right ventricle receives blood from which chamber? The options are left atrium, left ventricle, right atrium, or pulmonary veins. The correct answer is C, that is right atrium. Deoxygenated blood from the body enters the right atrium and is passed to the right ventricle, which pumps it to the lungs. Question number 3. A Braden scale score of 12 indicates which level of risk? The options are high risk, moderate risk, low risk, or no risk. The correct answer is A, that is high risk. A score of 12 or lower indicates a high risk of development pressure ulcers, necessitating preventive measures. Question number 4. Which factor is not assessed by the Braden scale? The options are sensory perception, mobility, nutrition, or pain. The correct answer is D, that is pain. The Braden scale evaluates sensory perception, moisture, activity, mobility, nutrition, and friction, but not pain. Question number 5. Which Braden scale category assesses the patient's ability to move in bed? The options are activity, mobility, sensory perception, or friction and shear. The correct answer is B, that is mobility. The mobility category evaluates how well a patient can change their body position independently. Question number 6. What is the term for low blood pressure? The options: hypertension, hypotension, hyperglycemia, or hyperlipidemia. The correct answer is B, that is hypotension. Hypotension refers to abnormally low blood pressure. It can cause symptoms like dizziness, fainting, fatigue, and may be indicative of underlying health issues. Question number 7. Which blood vessel experiences the highest pressure? The options are arteries, veins, capillaries, or venules. The correct answer is A, that is arteries. Arteries experience the highest pressure as they receive blood directly from the heart. Their elastic walls help to accommodate the surge of blood ejected by the heart during systole. Question number 8. What condition is characterized by consistently elevated blood pressure? The options are anemia, hypotension, hypertension, or bradycardia. The correct answer is C, that is hypertension. Hypertension is a chronic medical condition characterized by consistently elevated blood pressure levels. It is a significant risk factor for heart disease, stroke, and other complications. Question number 9. Which of the following lifestyle modifications can help lower blood pressure? The options are smoking, sedentary lifestyle, high sodium diet, or regular exercise. The correct answer is D, that is regular exercise. Regular physical activity can help lower blood pressure by improving heart health, reducing stress, and promoting weight loss. Question number 10. What is the name of the double-layered membrane surrounding the heart? The options are endocardium, myocardium, pericardium, or epicardium. The correct answer is C, that is pericardium. The pericardium is a double-layered sac that encloses and protects the heart, providing a lubricated environment for it to move smoothly within the chest cavity. Question number 11. Dear friends, there is one more announcement. Dear friends, as per your suggestions, we have started a new YouTube channel where we are conducting exam or assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. And the link of the channel has been given in the description. Let's continue. What is the normal resting heart rate range for an adult? Your options are 40 to 60 beats per minute, 60 to 100 beats per minute, 100 to 120 beats per minute, or 120 to 140 beats per minute. The correct answer is B, that is 60 to 100 beats per minute. The normal resting heart rate for adults typically ranges from 60 to 100 beats per minute, indicating a healthy and well-functioning cardiovascular system. Question number 12. Which of the following blood vessels has the highest blood pressure? Your options are capillaries, veins, arteries, or venules. The correct answer is C, that is arteries. Arteries experience the highest blood pressure as they receive blood directly from the heart, which pump it forcefully throughout the body. Question number 13. What is the primary function of red blood cells? Your options are to fight infection, to carry oxygen, to clot blood, or to produce antibodies. The correct answer is B, that is to carry oxygen. Red blood cells, RBCs, contain hemoglobin, a protein that binds to oxygen and transport it from the lungs to tissues and organs throughout the body. Question number 14. Which of the following conditions affects the right ventricle more than the left ventricle? The options are aortic stenosis, pulmonary hypertension, mitral valve regurgitation, or left ventricular hypertrophy. The correct answer is B, that is pulmonary hypertension. Pulmonary hypertension increases pressure in the lungs, causing the right ventricle to work harder. Question number 15. How does blood flow from the right ventricle to the pulmonary circulation? The options are through systemic veins, through pulmonary arteries, through pulmonary veins, or through capillaries. The correct answer is B, that is through pulmonary arteries. Blood from the right ventricle flows into the pulmonary arteries, which deliver it to the lungs for gas exchange. Question number 16. What structure supports the tricuspid wall in the right ventricle? Chordae tendineae, semilunar wall, mitral wall, or left atrium? The answer is A, that is chordae tendineae. The chordae tendineae are fibrous cords that attach the tricuspid wall to the papillary muscles, preventing wall prolapse during contraction. Question number 17. What is the purpose of papillary muscles in the right ventricle? The options are to close the pulmonary wall, to pull on the chordae tendineae, to pump blood into the aorta, or to initiate electrical impulses. The correct answer is B, that is to pull on the chordae tendineae. Papillary muscles contract to pull on the chordae tendineae, keeping the tricuspid wall closed during ventricular contraction. Question number 18. Which layer in arteries is responsible for vasoconstriction? The options are tunica intima, tunica media, tunica externa, or endothelium. The correct answer is B, that is tunica media. The tunica media, made up of smooth muscle, controls the constriction and dilation of blood vessels, regulating blood flow. Question number 19. Which of the following is a characteristic of veins? The options are thick walls, carry blood at high pressure, have walls, or carry blood away from the heart? The correct answer is C, that is have walls. Veins contain walls to prevent the backflow of blood, as they carry blood at low pressure toward the heart. Question number 20. Which vessel carries blood from the digestive organs to the liver? The options are hepatic vein, hepatic portal vein, inferior vena cava, or renal vein. The correct answer is B, that is hepatic portal vein. The hepatic portal vein carries nutrient-rich blood from the digestive organs to the liver for processing. Question number 21. Which type of blood vessel primarily transports blood under high pressure? The options are veins, capillaries, arteries, or venules. The correct answer is C, that is arteries. Arteries carry blood from the heart under high pressure, which is why their walls are thick and elastic to accommodate the pressure changes. Question number 22. Which blood vessels play a key role in regulating blood flow and pressure through vasoconstriction and vasodilation? The options are arteries, arterioles, capillaries, or veins. The correct answer is B, that is arterioles. Arterioles, by constricting or dilating, regulate the amount of blood that enters capillary beds, affecting overall. Question number 23. Which of the following best describes the structure of capillaries? The options are thick walls with smooth muscle, single layer of endothelial cells, walls containing walls, or elastic fibers for stretching. The correct answer is B, that is single layer for endothelial cells. Capillaries have very thin walls, just one cell thick, to facilitate the exchange of gases, nutrients, and waste products. Question number 24. What is the function of the tunica interna in blood vessels? The options are facilitate gas exchange, provide structural support, regulate blood pressure, or prevent backflow of blood. The correct answer is B, that is provide structural support. The tunica externa, also known as the tunica adventitia, is the outer layer of blood vessels that provides structural integrity and protection. Question number 25. Which blood vessels return oxygen-poor blood to the heart? The options are capillaries, arteries, veins, or arterioles. The correct answer is C, that is veins. The veins return deoxygenated blood to the heart, except for pulmonary veins, which return oxygen-rich blood from the lungs. Question number 26. Which virus is responsible for causing shingles? The options are varicella zoster virus, herpes simplex virus, cytomegalovirus, or Epstein-Barr virus. The correct answer is A, that is varicella zoster virus. The shingle is caused by the reactivation of latent varicella zoster virus, ZVZV, within dorsal root or cranial nerve ganglia. Question number 26. What is the main mode of transmission of the Zika virus? The options are mosquito bites, sexual contact, airborne droplets, or contaminated food and water. The correct answer is A, that is mosquito bites. The Zika virus is primarily transmitted to people through the bite of an infected mosquito, primarily of the Aedes species. Question number 26. Which of the following is an example of an enveloped virus? The options are hepatitis A virus, rotavirus, rabies virus, or norovirus. The correct answer is C, that is rabies virus. The enveloped viruses have a lipid membrane surrounding the protein capsid, as seen in the structure of the rabies virus. Question number 27. Which virus is responsible for causing German measles? Your options are rubella virus, measles virus, mumps virus, or varicella zoster virus. The correct answer is A, that is rubella virus. German measles, also known as rubella, is caused by the rubella virus. Question number 28. Which viral disease has been eradicated through vaccination? Your options are polio, measles, rubella, or smallpox. The correct answer is D, that is smallpox. Smallpox is the only viral disease that has been eradicated through vaccination efforts. Question number 29. In which type of cardiomyopathy is the left ventricle abnormally thick? Your options are dilated cardiomyopathy, hypertrophic cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy, or ischemic cardiomyopathy. The correct answer is B, that is hypertrophic cardiomyopathy. In hypertrophic cardiomyopathy, the walls of the left ventricle are abnormally thick, impairing its function. Question number 30. What is the primary cause of increased afterload on the left ventricle? Your options are hypotension, pulmonary hypertension, aortic stenosis, or bradycardia. The correct answer is C, that is aortic stenosis. Aortic stenosis increases the resistance against which the left ventricle must pump, raising afterload and workload. Question number 31. Which artery supplies oxygen-rich blood to the left ventricle? Your options are left coronary artery, right coronary artery, pulmonary artery, or subclavian artery. The correct answer is A, that is left coronary artery. The left coronary artery and its branches, such as the left anterior descending artery, supply blood to the left ventricle. Question number 32. Increased preload in the left ventricle results in increased stroke volume, decreased stroke volume, increased heart rate, or decreased ejection fraction. The correct answer is A, that is increased stroke volume. The preload refers to the amount of blood filling the left ventricle before contraction. An increase in preload enhances stroke volume due to Frank-Starling mechanism. Question number 33. Which of the following is an effect or chronic left ventricular hypertrophy? Your options are increased cardiac output, decreased oxygen demand, impaired diastolic function, or decreased ventricular pressure. The correct answer is C, that is impaired diastolic function. The chronic left ventricular hypertrophy stiffens the heart muscle, leading to impaired filling during diastole. Question number 34. Which heart sound is associated with the filling of the left ventricle? Your options are S1, S2, S3, or S4. The correct answer is C, that is S3. S3, also called as ventricular gallop, can occur during the rapid filling phase of the left ventricle, especially in cases of heart failure. Question number 35. What is the term for the phenomenon in which a virus loses its ability to cause disease? The options are attenuation, mutation, recombination, or replication. The correct answer is A, that is attenuation. Attenuation refers to the process by which a virus becomes less virulent or loses its ability to cause disease. Question number 36. Which virus is responsible for causing yellow fever? Your options are dengue virus, yellow fever virus, chikungunya virus, or Zika virus. The correct answer is B, that is yellow fever virus. Yellow fever is caused by the yellow fever virus, transmitted primarily by Aedes mosquitoes. Question number 37. What is the term for the viral genetic material that is integrated into the host genome and can be transmitted to subsequent generations? The options are provirus, retrovirus, oncovirus, or capsid. A provirus is a viral genome that is integrated into the host cell genome and is replicated along with the host cell's DNA. Question number 38. Which virus is responsible for causing infectious hepatitis? Your options are hepatitis A virus, hepatitis B virus, hepatitis C virus, or hepatitis D virus. The correct answer is B, that is hepatitis B virus. Hepatitis B virus, HBV, is a DNA virus that causes infectious hepatitis, a serious liver infection. Question number 39. What is the term for the protein coat surrounding the nucleic acid core of a virus? Your options are capsid, envelope, nucleocapsid, or glycoprotein. The correct answer is C, that is nucleocapsid. The nucleocapsid is the protein coat surrounding the nucleic acid core of a virus. Question number 40. Which virus is responsible for causing hemorrhagic fever with renal syndrome, HFRS? The options are hantavirus, arenavirus, filovirus, or virus. The correct answer is A, that is hantavirus. Hemorrhagic fever with the renal syndrome, HFRS, is caused by hantaviruses transmitted to humans through contact with the rodent urine, saliva, or feces. Question number 41. What is the term for a virus that primarily infects bacteria? The options are bacteriophage, retrovirus, viroid, or prion. The correct answer is A, that is bacteriophage. Bacteriophages are viruses that infect bacteria and are considered a natural predator of bacteria. Question number 42. Which of the following is not a function of the endocrine system? The options are regulation of metabolism, regulation of blood sugar levels, coordination of voluntary movements, or regulation of growth and development. The correct answer is C, that is coordination of voluntary movements. The endocrine system regulates metabolism, blood sugar levels, growth and development, and the various other physiological processes through the secretion of hormones, but it is not directly involved in coordinating voluntary movements. Question number 43. Which class of antibodies is the most abundant in the bloodstream of human immune system? Your options are IgA, IgD, IgG, or IgE. And the correct answer is C, that is IgG. IgG antibodies are the most abundant class of antibodies in the bloodstream, providing long-term immunity against a wide range of pathogens and toxins. Question number 44. Which of the following is not a part of the respiratory system? The options are lungs, trachea, esophagus, or bronchi. The correct answer is C, that is esophagus. The respiratory system consists of organs involved in the breathing such as the lungs, trachea, bronchi, and diaphragm. But it does not include the esophagus, which is a part of digestive system. Question number 45. Which cells are involved in the clearance of immune complexes and dead cells in the human immune system? The options are macrophages, neutrophils, dendritic cells, or mast cells. The correct answer is A, that is macrophages. Macrophages play a central role in phagocytosis and the clearance of immune complexes, apoptotic cell, and cellular debris, contributing to tissue hemostasis and resolution of inflammation. Question number 46. Which structure produces bile to aid in the digestion? The options are liver, stomach, gallbladder, or pancreas. The correct answer is A, that is liver. The liver produces bile, a greenish yellow fluid that aids in the digestion and absorption of the fats in the small intestine. Question number 47. What is the primary function of white cells, WBCs, in the human body? Your options are transportation of oxygen, defense against infections, blood clotting, or nutrient absorption. The correct answer is B, that is defense against infections. White blood cells play a crucial role in the immune system, defending the body against pathogens such as bacteria, viruses, and other foreign invaders. Question number 48. What is the primary cause of gastroesophageal reflux disease, which is known as GERD? Your options are excessive stomach acid, bacterial infection, viral infection, or autoimmune reaction. The correct answer is A, that is excessive stomach acid. GERD, which stands for gastroesophageal reflux disease, is often caused by the backflow of stomach acid into the esophagus, leading to symptoms like heartburn. Question number 48. What is the function of the pancreas in digestion? Your options: producing insulin, producing bile, producing digestive enzymes, or storing nutrients. The right answer is producing digestive enzymes. The pancreas produces digestive enzymes that includes amylase, lipase, and proteases, which in the digestion of carbohydrates, fats, and proteins. Question number 49. What is the primary purpose of the Glasgow Coma Scale, GCS? Your options are to assess motor function, to evaluate cognitive function, to measure neurological status, or to monitor vital signs. The correct answer is C, that is to measure neurological status. The Glasgow Coma Scale, GCS, is a neurological assessment tool used to evaluate a patient's level of consciousness based on eye-opening, verbal response, and motor response. It is commonly used in patients with head injuries or altered mental status. Question number 50. Dear friends, there is one more announcement. Dear friends, as per your suggestions, we created a new YouTube channel where we are conducting exam or assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. And the link of the channel has been given in the description. Let's continue. Which class of antibodies is the most abundant in the bloodstream of human immune system? Your options are IgA, IgD, IgG, or IgE. And the correct answer is C, that is IgG. IgG antibodies are the most abundant class of antibodies in the bloodstream, providing long-term immunity against a wide range of pathogens and toxins. Question number 51. Cells are responsible for antibody-mediated immunity in the human system. The options are B cells, T cells, natural killer cells, or macrophages. The correct answer is A, that is B cells. B cells are primarily responsible for antibody-mediated immunity as they produce antibodies that recognize and neutralize pathogens, leading to their destruction or clearance from the body. Question number 52. Which class of antibodies is found predominantly in secretions such as saliva, tears, and mucous membranes in the human immune system? Your options are IgA, IgD, IgE, or IgG. The correct answer is A, that is IgA. IgA antibodies are predominantly found in secretions such as saliva, tears, and mucous membranes, where they provide localized immunity against pathogens that enter through mucosal surfaces. Question number 53. Which cells are responsible for the release of cytokines and chemokines to recruit other immune cells during an immune response in the human immune system? Your options are B cells, T cells, macrophages, or eosinophils. The correct answer is C, that is macrophages. Macrophages release cytokines and chemokines to recruit other immune cells to the site of infection or inflammation, playing a crucial role in coordinating the immune response. Question number 54. Which cytokine is primarily involved in promoting the differentiation of naive T cells in cytotoxic T cells, CD8 plus T cells, in the human immune system? Your options are interleukin 2, interleukin 4, interleukin 12, or interferon gamma. The correct answer is C, that is interleukin 12. Interleukin 12 promotes the differentiation of naive T cells into cytotoxic T cells, CD8 plus T cells, which play a central role in mediated immunity by directly killing infected or abnormal cells. Question number 55. Which cells are involved in the recognition and elimination of cancer cells in the human immune system? The options are B cells, T cells, natural killer cells, or mast cells. The correct answer is C, that is natural killer cells. Natural killer cells recognize and eliminate cancer cells and virus-infected cells through mechanisms like direct cytotoxicity and the release of cytokines, contributing to immune surveillance against tumors. Question number 56. Which class of antibodies is involved in the defense against extracellular pathogens such as bacteria and parasites in the human immune system? Your options are IgA, IgD, IgG, or IgM. And the correct answer is C, that is IgG. IgG antibodies play a crucial role in the defending against extracellular pathogens such as bacteria and parasites by opsonization, complement activation, and neutralization. Question number 57. Which cells are primarily responsible for producing antibodies with high affinity through somatic hypermutation in the human immune system? The options are plasma cells, memory B cells, T helper cells, or dendritic cells. The correct answer is B, that is memory B cells. Memory B cells undergo somatic hypermutation, a process that increases the activity of antibodies, resulting in the production of antibodies with higher specificity and effectiveness upon re-exposure to antigens. Question number 58. Which cytokine is primarily involved in promoting the differentiation of naive T cells into Th1 cells in the human immune system? The options are interleukin 2, interleukin 4, interleukin 12, or interleukin gamma, or interferon gamma. And the correct answer is C, that is interleukin 12. IL-12 promotes the differentiation of naive T cells into Th1 cells, which are important for cell-mediated immunity and the activation of macrophages. Question number 59. Which cells are primarily responsible for the recognition and elimination of virally infected cells in the human immune system? The options are B cells, T cells, natural killer cells, or eosinophils. The correct answer is B, that is T cells. Cytotoxic T cells, CD8 plus T cells, are primarily responsible for recognizing and eliminating virally infected cells through direct cytotoxicity, contributing to the control of viral infections. Question number 60. Which class of antibodies is involved in the mediation of immediate type of hypersensitivity reactions in the human immune system? The options are IgA, IgD, IgE, or IgG. And the correct answer is C, that is IgE. IgE antibodies mediate immediate type of hypersensitivity reactions such as allergies and anaphylaxis by binding to mast cells and basophils. Question number 61. What is the thickest layer of the uterine wall? Your options are perimetrium, endometrium, myometrium, or submetrium. The correct answer is C, that is myometrium. The myometrium is the thick muscular layer that facilitates uterine contraction during labor. Question number 62. Where does fertilization most commonly occur? Your options are ovary, fallopian tube, uterus, or cervix. The correct answer is B, that is fallopian tube. Fertilization typically takes place in the ampulla, the widest section of the fallopian tube. Question number 63. Which of the following structures stores and releases eggs? Your options are uterus, ovary, fallopian tube, or cervix. The correct answer is B, that is ovary. The ovary stores immature eggs and release a mature egg during ovulation each menstrual cycle. Question number 64. What hormones is primarily responsible for maintaining pregnancy? Your options are estrogen, progesterone, LH, or oxytocin. The correct answer is B, that is progesterone. Progesterone maintains the uterine lining and inhibits contraction to support the pregnancy. Question number 65. What is the structure that serves as the birth canal during childbirth? Your options are cervix, uterus, fallopian tube, or vagina. The correct answer is D, that is vagina. The vagina acts as the birth canal, allowing the baby to pass through during delivery. Question number 66. What is the functional significance of the ovarian follicles? Your options are produce eggs and hormones, support uterine contraction, trigger menstruation, or prevent implantation. The correct answer is A, that is to produce eggs and hormones. Ovarian follicles nurture developing eggs and secretes hormones like estrogen and progesterone. Question number 67. What is the central cavity of the uterus called? Your options are uterine lumen, endometrial cavity, uterine fundus, or cervical canal. The correct answer is A, that is uterine lumen. The uterine lumen is the cavity within the uterus where the fertilized egg implants and develops. Question number 68. Which phase of the menstrual cycle occurs immediately after ovulation? Your options are menstrual phase, follicular phase, luteal phase, or proliferative phase. The correct answer is C, that is luteal phase. During the luteal phase, the corpus luteum forms and secretes progesterone to prepare the uterus for implantation. Question number 69. What is the role of the fimbri in the female reproductive system? Your options are support uterine contractions, capture the ovulated egg, facilitate fertilization, or reduce estrogen. The correct answer is B, that is to capture the ovulated egg. The fimbri are finger-like projections of the fallopian tube that guide the egg into the tube after ovulation. Question number 70. Which part of the reproductive system prevents infections in the uterus? Your options are cervix, endometrium, fallopian tube, or ovaries. The correct answer is A, that is cervix. The cervix produces mucus that acts as a barrier to infections and protects the uterine environment. Question number 71. What is the corpus luteum? Your options are a fertilized egg, a temporary structure in the ovary, a layer of the uterus, or a part of the fallopian tube? The correct answer is a temporary structure in the ovary, option number B. The corpus luteum forms from the follicle after ovulation and secretes progesterone to maintain the uterine lining. Question number 72. What happens to the corpus luteum if fertilization does not occur? Your options are: it enlarges, it degenerates into corpus albicans, it secretes more hormones, or it transforms into a new follicle. The correct answer is B, that is, it degenerates into the corpus albicans. Without fertilization, the corpus luteum breaks down and forms a scar-like structure called the corpus albicans. Question number 73. What is the primary function of the endometrium? Your options are: produce hormones, protect the ovaries, support implantation and fetal development, or release egg. The correct answer is support implantation and fetal development. The endometrium thickens to allow implantation of the fertilized egg and support pregnancy. Question number 74. What type of cells line the fallopian tubes? Your options are: stratified squamous, ciliated columnar, cuboidal, or transitional. The correct answer is B, that is ciliated columnar. The ciliated columnar cells in the fallopian tubes help to move the egg toward the uterus. Question number 75. Which of the following structures is not part of the lymphatic system? The options are: spleen, thymus, liver, or lymph nodes. The correct answer is C, that is liver. While the liver plays a role in filtering blood and producing proteins, it is not part of the lymphatic system, which includes the spleen, thymus, lymph nodes, and lymphatic vessels. Question number 77. What is the function of the mitral wall in the heart? Your options are: preventing blood from flowing back into the left atrium, preventing blood from flowing back into the right atrium, directing blood flow from the right ventricle to the pulmonary artery, or directing blood flow from the left ventricle to the aorta. The correct answer is D, that is directing blood flow from the left ventricle to the aorta. The mitral wall, also known as the bicuspid wall, regulates blood flow from the left atrium to the right, from the left atrium to the left ventricle of the heart. Question number 78. What is the function of the iris in the eye? Your options are: focusing light onto the retina, producing tears, the amount of the light entering the eye, or detecting light intensity. The correct answer is C, that is regulating the amount of light entering the eye. The iris is the colored part of the eye that controls the size of the pupil, regulating the amount of light that enters the eye. Question number 79. Which of the following structure is not part of the digestive system? The options are: stomach, liver, lungs, or small intestine. The correct answer is C, that is lungs. While the lungs are involved in respiration, they are not part of the digestive system, which includes organs such as the stomach, liver, and small intestine. Question number 80. What is the function of the trachea in the respiratory system? The options are: producing mucus, filtering air, exchanging gases, or conducting air to and from the lungs. The correct answer is D, that is conducting air to and from the lungs. The trachea or windpipe conducts air to and from the lungs, allowing the respiration. Question number 81. What is the function of the alveoli in the respiratory system? The options are: producing mucus, filtering air, exchanging gases, or conducting air to and from the lungs. And the correct answer is exchanging gases. Alveoli are tiny air sacs in the lungs where Dear friends, there is one more announcement. Dear friends, as per your suggestions, we have started a new YouTube channel where we are conducting assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. And the link of the channel has been given in the description. Let's continue. Gas exchange. It means oxygen and carbon dioxide. It occurs between the lungs and the bloodstream. Question number 82. Which of the following structure is not part of the male reproductive system? The options are prostate gland, ovary, seminal vesicles, or testes. The correct answer is B, that is ovary. The ovaries are part of the female reproductive system and are responsible for producing eggs and hormones such as estrogen and progesterone. Question number 83. Which of the following structure is responsible for producing insulin in the endocrine system? The options are adrenal gland, thyroid gland, pancreas, or pituitary gland. The correct answer is C, that is pancreas. The pancreas produces insulin, a hormone that regulates blood sugar levels. Question number 84. What is the function of the cerebrum in the brain? The options are regulating body temperature, processing sensory information, coordinating voluntary movements, or regulating hormone production. And the correct answer is B, that is processing sensory information. The cerebrum is the largest part of the brain and responsible for processing information, higher brain functions, and voluntary movements. Question number 85. Which of the following structure is not part of the lymphatic system? The options are lymph nodes, spleen, liver, or thymus. And the correct answer is C, that is liver. While the liver plays a role in filtering blood and producing proteins, it is not part of the lymphatic system, which include lymph nodes, spleen, thymus, and lymphatic. Question number 86. What is the largest organ in the human body? The options are heart, liver, skin, or brain. And the correct answer is C, that is skin. The skin is the body's largest organ, serving as a protective barrier against pathogens, regulating temperature, and aiding in sensation. Question number 87. Which bone is often referred to as the funny bone? The options are humerus, radius, ulna, or femur. And the correct answer is A, that is humerus. The humerus bone located in the upper arm is often called the funny bone due to the tingling sensation felt when it is struck. Question number 88. Which of the following structures is not part of the digestive system? Stomach, liver, lungs, or small intestine? The correct answer is lungs. While the lungs are involved in the respiration, they are not part of the digestive system, which includes organs such as stomach, liver, and small intestine. Question number 89. Which of the following bones is not a part of the axial skeleton? The options are clavicle, sternum, sacrum, or patella. The correct answer is D, that is patella. The patella or kneecap is a sesamoid bone located within the tendon of the quadriceps femoris muscle, and it is the part of the appendicular skeleton but not the part of axial skeleton. Question number 90. Which organ is responsible for filtering blood and producing urine? The options are liver, kidneys, pancreas, or spleen. The correct answer is B, that is kidneys. The kidneys filter waste products from the blood to produce urine, maintaining the body's fluid and electrolyte balance. Question number 91. Which of the following is not a function of the endocrine system? The options are regulation of metabolism, regulation of blood sugar levels, coordination of voluntary movements, or regulation of growth and development. The correct answer is C, that is coordination of voluntary movements. The endocrine system regulates metabolism, blood sugar levels, growth and development, and the various other physiological processes through the secretion of hormones. But it is not directly involved in coordinating voluntary movements. Question number 92. Which of the following is not a type of joint in the human body? The options are ball and socket, hinge, pivot, or ligament. The correct answer is D, that is ligament. Ligaments are fibrous bands of connective tissue that connect bones to other bones, while ball and sockets, hinge, and pivot are types of joints that allow for different types of movements. Question number 93. Which structure is responsible for producing red blood cells, RBCs? The options: liver, kidneys, bone marrow, or spleen. And the correct answer is C, that is bone marrow. Red blood cells are produced in the bone marrow, the spongy tissue found inside certain bones, such as the sternum, ribs, and pelvic bones. Question number 94. What is the smallest bone in the human body? The options are stapes, tibia, femur, or radius. The correct answer is A, that is stapes. The stapes, also known as stirrup, is located in the middle ear and it is involved in this transmission of sound vibrations. Question number 95. What is the primary function of the small intestine? The options are absorption of nutrients, digestion of food, production of digestive enzymes, or storage of waste products. And the correct answer is A, that is absorption of nutrients. The small intestine is responsible for absorbing nutrients from digested food into the bloodstream. Question number 96. Which of the following is not a function of the skeletal system? The options are support, protection, hormone production, or movement. The correct answer is C, that is hormone production. While bones do play a role in hormone regulation by releasing osteocalcin, but they are not primarily responsible for hormone production. Question number 97. Which blood vessel carries deoxygenated blood to the lungs? The options are pulmonary artery, pulmonary vein, aorta, or vena cava. The correct answer is A, that is pulmonary artery. The pulmonary artery carries deoxygenated blood from the heart to the lungs for oxygenation. Question number 98. Which of the following is the largest blood vessel in the body? The options are vein, artery, capillary, or aorta. The correct answer is D, that is aorta. The aorta is the largest artery in the body, carrying oxygenated blood from the heart to the rest of the body. Question number 99. What is the normal range of systolic blood pressure in adults? The options are 80 to 120 mmHg, 120 to 140 mmHg, 140 to 160 mmHg, or 160 to 180 mmHg. The correct answer is A, that is 80 to 120 mmHg. The normal systolic blood pressure typically ranges between 80 to 120 mmHg. This represents the pressure exerted on the arterial walls during heartbeats, reflecting the force when the heart contracts. Question number 100. Which of the following is the main function of the cardiovascular system? The options are digestion, respiration, transportation of nutrients and oxygen, or excretion. The correct answer is C, that is transportation of nutrients and oxygen. The cardiovascular system's primary role is to transport nutrients, oxygen, and hormones to cells throughout the body and to remove metabolic wastes. So dear friends, it's the time to comment your score. So let us see what is your score. Please comment your score. And if the video was helpful, then please comment your view on this video. And do support us by liking and subscribing and sharing our channel, our videos. So thank you so much for